My granddaughter, Sara, was very, very smart. She talked early, she walked early, she was just very happy.
I was a veterinarian.
My dad was the type of guy who makes house calls.
A very athletic guy.
Went to the gym all the time.
I was the director of membership at one of the largest cultural institutions in Los Angeles.
I was big into sports. I was intelligent.
Kinser graduated with honors. The plan was to go off to college. 2 weeks after high school graduation, the police came to our house and told us that Kinser had been in an accident.
I had a traumatic brain injury.
He was on life support. If the machine wasn't breathing for him, he would have died.
I managed to get into a major car accident and sustain major injuries. I came conscious to double vision. I couldn't walk. I couldn't function as a normal independent like I was before.
I don't remember the accident, but I was barefoot water skiing and I fell, and that's when I got the brain injury. The doctors didn't think I'd ever walk again. They didn't know if I'd ever be able to talk again or even swallow food.
A young 19-year-old came up behind us doing 55 miles an hour, put the back of our car up in the front. Sara didn't have a scratch on her, but she lost 95% of the left side of her brain in that accident.
They were trying to send me to a nursing home. My father was like, no, you're not going there.
One of the welfare workers at the main hospital gave me a brochure for CNS, and she said, we feel that this is probably the best facility.
The hospital said that she was brain dead, but her pediatrician said, I've seen CNS work miracles.
The motto here at the Center for Neuroskills is actually find a way. We have regional, highly specialized care in this field.
We've always taken the perspective that it's built around what the patient's needs are.
Hold on to this please. First few weeks, actually, of going to CNS was all assessment. They presented their first report, and they came up with therapy goals. The goal drives the therapy. So for Kinser, his main goals were getting back to school, being able to drive again, and being able to live independent.
An injury to the brain affects the entire body, so there's nothing in the system that's immune from the effects of the brain injury.
Julie had balance problems, coordination problems, optical problems, speech problems. So the insurance company approved her going 5 days a week, 6 hours a day, and they started to, approach and attack each of these problems one at a time.
So we're gonna make breakfast today.
There's no other place that we had seen or heard of that did therapy the way they do it all day long.
Our treatment model is so intense, it's not replicated elsewhere. People don't provide as much therapy as we do. This is all we do.
That kind of relates back to this lesson, right? About asking for help.
No brain injury is alike, so that makes every program unique. And we don't see each other as separate departments.
It's like a puzzle, and each one of the therapists in each of the different disciplines put their piece in.
Come on, Sara. Over here.
The first day that I brought her here, she laid there like a little lump of clay. She could not move anything. Some days I'd watch them and I'd say to my husband, I don't get it. What's that gonna do? And then in a few days you'd see her trying to crawl.
My dad literally had to learn how to walk again.
To graduate from a wheelchair and a walker, then to a cane was feeling good. Eventually I got where I could walk without the cane.
That's a good strategy to have at school, too.
No one else was offering academic therapy, and that was what he needed the most because he was supposed to be going to college.
Counseling also helped me out a lot.
Counseling was huge for him because he was young and his whole life was just kind of stopped.
You can talk about everything, and so that was really helpful.
Let's move on to the cognition module.
The cognitive therapies work on your memory and work on your attention, which will help when I have to go back to work.
My vision was really messed up.
So then in occupational therapy, that's what they worked on.
Okay, always watch your arm.
I certainly know my dad has never cooked for himself, or at least, without burning it. And he was taught these wonderful occupational skills of going to the grocery store, cooking it, bringing it back.
They would periodically test me and then make reports.
The reports were very extensive and incisive and very specific. And they gave, real readings of where she was at certain points.
It's very important for us to collect data so we're able to track their progress so that we can progress much faster.
Look who's been sitting up for almost 2 minutes.
If you have access to the right people at the right time, doing the right things, the opportunities to make a difference are there.
Good. Nice step, Sara.
We've seen patients years after injury, and they still make progress. They can still make change. That's important to know.
There are no hopeless cases. She could do one little thing, and then all of a sudden she could do 4 little things. And I can see now how much she's progressed. It's amazing.
Jillian, would you share what you did on your leave?
Okay. I put the words that I was grateful for. I put my shoes on there because I'm mobile now. I wasn't 3 months ago.
You can't give up on the person to begin with.
The fact that I can actually cognitively hold this conversation with you is pretty much a miracle, and that I'm not paralyzed is a miracle.
People like Jillian that are brought back eventually, hopefully, will go back to work and, be active and productive again. That's what you want. That's what you want for Jillian. That's what you want for society.
It's completely worth it. He finished his therapy and he met all his goals, and now he's on track to where he would have been before his accident.
Right now, I am at Cal Poly. I live in the dorms. I'm really kind of looking at becoming a therapist. All the help that I got at CNS, I want to be able to do that because really they changed my perspective of life.
When my dad went back to work, I was astounded. Not only that he went back to work, but was working full-time, doing surgeries.
The therapists actually have used the term miracle, but I think it was just the good care I was receiving.
There was a process here, and there's a history, and people know what they're doing.
There you go. Do it again.
What they need most is the time to get it done.
Everyone looks for the magic bullet or the magic pill, trying to find that easier way, that cheaper way, and it really requires a lot of hard work.
The insurance company, in Jillian's case, put out a tremendous amount of money. You get what you pay for.
This is worth it if you want somebody to regain their independence and be able to function, because it actually does work.
If you make your decisions in the patient's best interest, you're not wrong.
It's somebody's brother, it's somebody's sister, it's somebody's mother, it's somebody's father. They matter.